Good afternoon, everyone. My name is Alan Harris. I'm the emergency manager here in Seminole County. And we wanted to do this Facebook Live to inform our residents of everything that's going on with the COVID-19 coronavirus response. We do this typically when there's a hurricane or any other type of emergency where there's a threat to the county, and we just wanted to make sure that we provide the most correct and up-to-date information to our residents. And of course, this will be saved and will be able to be viewed at a later time. It's very important for us to immediately notify everybody that there are no cases of COVID-19, no coronavirus here in Seminole County. We don't have anyone that is a suspected case at this time of coronavirus. So right now, very safe in Seminole County, very low threat to the county at this time. So there are 4 cases in the entire state of Florida, 2 over in Hillsborough County, 1 in Manatee County, and yesterday we were informed that there was a presumptive positive case in Santa Rosa County. But again, no case in the Central Florida area and no case here in Seminole County. Seminole County, though, of course, has taken a very proactive response to COVID-19. We want to make sure that our community is safe, that if it does come here, that we are ready to go. We've been doing that since January. So in January, the Florida Department of Health, Seminole County Sheriff's Office, Seminole County Fire Department, all the other EMS and fire departments, the Orlando Sanford International Airport and the Office of Emergency Management all got together to discuss pandemic planning specific to COVID-19 and the coronavirus, because we saw what was going on, but also just to review all of our response plans for Ebola and other types of pandemics as well. We did have a focus, though, on COVID-19. And during that time, we looked at a couple different things that we needed to do here in Seminole County to take protective measures. And we've done that over the last few months. So that includes protecting our emergency medical services units, making sure that there is good sanitation for all of those. So if we did have to transport someone, that we can quickly sanitize that rescue unit and put it right back in service as quickly as possible to respond to the next event. It could be a heart attack patient, it could be a vehicle collision, whatever. But we want to make sure that unit is very safe, very clean, and right back in service as quickly as possible. We wanted to work with all of our medical providers. So when we are transporting individuals to a hospital, that they are well aware of a potential COVID-19 or coronavirus case coming into the hospital. So we've been working with all of the emergency departments, the infection control individuals at each one of the 4 hospitals, and the emergency departments, the 3 emergency departments throughout the standalone emergency departments in Seminole County. So we wanted to make sure that we had good communication between our EMS units and those facilities. We've also been working with our Florida Department of Health. They've been the lead in contact tracing. And what that means is, as individuals from other countries come back into the United States, and of course in Seminole County we have folks that travel all over the world. I'll be traveling actually in a couple weeks to the Southern Caribbean. And as individuals come back from those high targeted areas, those areas where there is potential for COVID-19, or we've seen some increased cases of COVID-19, they're monitoring those individuals, communicating with those individuals, and if anyone gets sick, then we are immediately responding to those individuals as quickly as possible. We are providing personal protective equipment, of course, for our first responders, as well as we have taken it to the next level, and we want to make sure that if someone does come, and we tried to thought about all the what ifs. So if someone comes into the county, someone is identified with COVID-19, they for some reason have to go to the hospital, we've gone to the point of who's going to take care of their animal. So animal services now, the veterinarian over there, the vet techs have the appropriate personal protective equipment to make sure that that they are taken care of and that they can take care of the animals. I have a question here. When will the county discourage large gatherings? Not for a long time, it looks like, because right now we haven't even had our first case. So, you know, what we're going to say is what we say always, and that is, if you have the flu, if you forget COVID-19 for a minute, if you have the flu, if you're sick for some reason, please, please, please don't go to work. Please don't go to the gym. Please don't go to large gathering places like churches or concerts or sporting events where other people can get infected. This is not just a COVID-19 thing. This is a all types of viruses type of public safety message. So right now, the cases are 0 in the county. It would take quite a few cases for us to start canceling large gathering locations. We're not seeing that really anywhere in the country except for in the state of Washington. In the state of Washington, there's a couple cities there, Santa Clara and a couple other cities, where they're doing some protective measures as far as closing down some locations. But we're talking about a large number of individuals that would have to be affected for us to do something like that. There is plans for those types of activities if that ever happens, heaven forbid. But right now we're not seeing anywhere. Right now we're not seeing any cases at all. But if we did, then we would potentially look at that. So there was a question about hospitals releasing patients over the last month with symptoms. The symptomology, any of the patients that go in have to meet a certain threshold to be tested. I'm very happy to report today that LabCorp and Quest by the end of the weekend, Monday, will be able to test for COVID-19. So that's a new thing that's happened over this week and then into next week. But to be tested before these two facilities were available and private labs were able to test, you really needed to meet the guidelines for being tested. And what the guidelines for being tested would be lower respiratory infections, fever, coughing, things like that. So if other symptoms were presented, and if the individual said, I think I have COVID-19, but has traveled nowhere in a location where COVID-19 was identified, has not been around anyone that's traveled into those locations, we're not going to really test those people because the likelihood of them having COVID-19, and again, this is up till today, is extremely minimal. So they did not test. I will tell you now, since because there was limited test kits. Now there are a lot more test kits. Now the private laboratories can do it. So you will start to see that people now may potentially get, based on a doctor's recommendation, may get tested for COVID-19, being just simply sent to LabCorp or Quest. If we do receive information from LabCorp or Quest or the doctor's office that COVID-19, a presumptive positive case, is affected, there is a plan. Again, we've been talking about earlier in the video of all the agencies that have been working. We've been meeting regularly. So if we have a presumptive case, we are here to help work with that individual, self-isolating at home, support services, wraparound services for that family, that individual and that family, even to the point of taking care of their animal if they have to go to the hospital, taking care of the family, making sure that they have the appropriate medication so they don't have to go to the pharmacy, that they get their insulin or heart medication or whatever they're on to their home so that they can truly self-isolate and prevent the spread of COVID-19. That's really our priority right now, is if we do get a case in the county, to prevent that spread, prevent that from getting anywhere further. And we're going to take very high precautions to make that a reality, because we don't want to go back to the Sanders question. We don't want to get to a point where we're having to cancel large gatherings. We don't want to have to cancel schools or anything like that. The school board has been working very closely with us. They have enhanced cleaning services. They've been doing a lot of planning with us, and they've been doing a lot of planning on their own. Parents should have received 2 or 3 notifications already from the schools, and of course the teachers and staff there have as well. We work very, very closely with them, and they have a great plan in place to do enhanced cleaning if necessary, and to protect the schools if that becomes a necessary item. We currently in the county, we have an emergency incident, what we call an incident action plan. So that plan includes epidemiology tracing. So if a person is sick, who works around that individual, who potentially could be a vulnerable person to that particular individual that was sick. So if they were nearby and they potentially could have caught COVID-19, that we want to make sure that those individuals self-isolate. So we have a good plan for that. We have a good plan for support services, the wraparound services. We have a good plan for EMS services, and then we also have a good plan for isolation and quarantine, so making sure that we can provide assistance to families if they are asked to do that. We have a tabletop exercise also that's coming up, so that's going to be with our healthcare providers. We're looking at medical surge, we're looking at EMS response, and we're looking at how we continue governmental services. So we want to make sure that we have a good plan in place, that all essential services stay in full operation. Even if we have quite a few employees that are sick, we want to make sure that county government and government in all is responding very quickly and continuing operations. I will say that, and I won't get into it too much, but I will say that I've had a conversation we have an amazing elections office, just an amazing man that works over there, Chris Anderson. I worked with him earlier this week and last week. They are ready for elections. It's going to be very safe. There's lots of cleaning solutions, lots of different things to make sure that the polls are super clean and nothing to worry about there. It'll be the cleanest election we've ever had as far as going in, and you'll probably smell the Lysol and such. So it'll probably be the nicest and cleanest you've ever seen it. He's got a great plan in place with lots of things. So I'm going to go out and vote. I hope you will too. And it's very, very safe to do so. We've been working very closely with the CDC and the Florida Department of Health to obtain information and provide information. Last night, we worked with over 130 faith-based leaders to talk about church and synagogues and temples and how to protect those, how to continue their operations, how to make it as safe as possible for things like communion and collection plates and things like that. So we talked about all those types of things. Last night, they've got a good action plan, those individuals. We're working with, and I'm sure you've seen the news, we've worked with assisted living facilities and nursing homes and adult daycares and things like that. And we have a workshop coming up on March 16th with the administrators of those organizations, and just making sure that they're all set as well. So we've been doing a lot of community outreach. We're working with business leaders. On March 31st, we're going to be working with the Seminole County Chamber of Commerce and some business leaders to make sure that they have the appropriate information. And then on April 1st, working with Leadership Seminole also to make sure that they have the appropriate information. So trying to get a lot of good information out there. We have information, of course, on our website, so you can always go to prepareseminole.org. It lists down all types of activities, what's happening here in Seminole County. There's a video there. It's a very simple video about some easy steps that you can take. Hopefully you've seen the video. We don't want people to be alarmed. We want people to do what really they should normally do if you have the flu, if you have colds, things like that. Wash your hands, don't go to work if you're sick. Businesses should think about work at home policies for individuals if they are sick, sending people home if they're sick, and cleaning the areas around them. Just some basic stuff. I'm not an emergency manager that's going to go go run out and buy a whole bunch of supplies right now. I know that people are doing that, and don't go buy all the Lysol and stuff like that. Enough for your home to do general cleaning, what you would buy normally for your cleaning. All our water systems are working perfectly. So there's no reason to go out and buy a whole bunch of bottled water. I mean, if you want to do that, that's great. Hurricane season is coming up. But for this event, you do not need to go and empty all the bottled water off of the grocery store. The water systems in Seminole County, all of our municipal water utilities are working at a 100% efficiency, and the COVID-19 is not going to stop that. Hurricanes maybe, not a virus. So just think about that. Certainly, if you want to go out and buy some water, be nice for hurricane season, put that off to the side. You already started your hurricane disaster kit, but the chances of you using it on this particular event is probably pretty low. Let's see, some other questions here. Yeah, so Sandra referenced the virus that spread through the nursing home. Again, really just trying to make sure that we have good information. So who we asked to the ALF nursing home, the assisted living facility nursing home, hospitals, adult daycares, places like that. So we have the administrators come in, the maintenance and custodial managers, nursing staff, things like that. So we'll be pushing a lot of good information out to those individuals so that they can make sure that those the safe ones. So I see Tamara. What about people who went to the Bahamas? So Tamara, I'll just tell you, just my closest friends here on Facebook Live, the community of Seminole County. I am going to the Southern Caribbean. So if I didn't feel it was safe to go to St. Martin, Aruba, Bonaire, Carousel, I'm going on a cruise, obviously. And if I didn't feel it was unsafe to go on a cruise ship, after I've read all of the stuff that's coming out of the CDC, I feel perfectly comfortable getting on that boat to the Southern Caribbean. The Southern Caribbean and the Bahamas, it's not a hotbed. If my cruise ship was going to China, if my cruise ship was going to Italy, I may rethink right now going to those areas where there's a very large number of COVID-19. But if you have a trip planned to go to the Bahamas, man, I hope you have a great time. I hope you have a lot of fun. I hope I'm going to as well, and I plan to. So I hope you have a great trip and just really enjoy that. So again, no COVID-19 here in Seminole County, no COVID-19 in the Central Florida area at this time. We are ready if it does take place. Isolation and quarantine, that's our number one. Making sure that how you can prevent it is if you're sick. Certainly don't go to work. Don't go to the gym. Don't try to sweat it out. Don't go to any large gathering locations. Don't take it to church. Don't take it to a concert. Don't take it to a sporting event. Get well, and this is like for anything else. Again, flu, COVID-19, whatever the case may be. Get well, and then enjoy those things. Central Florida has a lot to offer, and we certainly want you to enjoy large gathering locations when you're well. If you are well, of course, there's certain things that you can do. And again, washing hands. We keep saying this, right? Washing hands. And I know that I'm now sing happy birthday. I've been singing happy birthday a lot lately. I sing happy birthday twice because we're supposed to wash our hands for 20 seconds. So I sing happy birthday twice every time I go into the bathroom. Every time I go to the gym, I make sure that before I leave the gym, I wash my hands 20 seconds again, singing happy birthday twice. And sometimes I use a little hand sanitizer because they have them all over the gym as well. When I go into my grocery store has the cleaning solutions right there. I always wipe down my cart. I'm not going to say anything to anyone that I wouldn't do myself. So I suggest you do that as well. Someone said a positive case in Kissimmee. No, we have not heard anything about a positive case in Kissimmee. We would be notified pretty quick. We knew about the Santa Rosa one before it actually hit the news yesterday. I haven't heard the one in Kissimmee. So here's another thing. There's a lot of rumors out there. So I cannot tell you how many people have told me that there's coronavirus in the Central Florida area. Well, guess what? There is. Different strains of the coronavirus, not COVID-19. One of the strains of coronavirus is the cold. So yes, that's here. Yes, that could be, but that is not the COVID-19. That's not what we're talking about. So you may hear, hey, there's coronavirus somewhere. Well, that's probably true. It could be the common cold, a coronavirus. So, but COVID-19, we haven't heard anything about that. There's a question here, can pets be carriers? So right now, the CDC is saying do not, if you're sick, do not work with your pet too much. If you're the sole individual that takes care of the pet, try not to get the pet up near you too much. We did hear of one case where a dog was a carrier of the COVID-19. So right now we're still learning information, but there is the potential of that. So we want to make sure that if you're sick, have the other family members take care of the animal. I know when I'm sick, the dog loves to come up and rub on me. I'm just going to have to, potentially if I get it, I just have to remember No, the dog needs to stay away from me. I can talk to the dog can stay off the bed, but it doesn't need to be up here with me. So just try to keep, and if you think about it, if you're petting on the dog, and this is just for normal anything, right? So you're petting on the dog and you have the flu, and the dog runs into the other room, and mom or dad or sister or brother starts petting on the dog and then puts their hands on their eyes and such, then potentially they could get the flu as well. So just monitor that. If the dog does get up in the bed, or the cat or whatever, make sure you watch that animal very, very well, because you don't want anything on them if they go into the other room with the other family members. We certainly don't want this spread around your house, right? So just make sure of that. Let's see. Again, I just want to reiterate, prepareseminole.org has a lot of great information on there. We're going to continue to keep that updated. It does have links, of course, to the website. So we always encourage you to go to the websites with good information, and that is really the Center for Disease Control and the Florida Department of Health. So those are the two authorities. Certainly the World Health Organization as well has some great information. So you can go to the WHO, the World Health Organization. They've got some great information as well. CDC or Florida Department of Health. Avoid information on social media, except for we're providing social media right now, but from not an unqualified source. So, and I'm not saying this about my aunt, I love it, but if my aunt is posting something about COVID-19, unless she's copying it from CDC, probably need to double check on that. So love you, aunt, if you're watching, but I'm going to go ahead and double check that. So if you have a family member, a friend that's sending you some information, unless it's copied from the CDC or unless it's copied from the World Health Organization or Florida Department of Health, take it with a grain of salt, and then double research that before you want to confirm, or before you want to push that information any further. I know I am at the end of time. Actually, I'm 1 minute over, so I just want to thank you all again. Seminole County is doing what we can to make sure that everyone is safe from COVID-19. Again, no cases right now in Seminole County, but we are ready if we start to see a case or two. So thank you very much, and I hope you all have a wonderful day.